many women who do not ovulate at around 14 day. So after a single scan should always be interpreted with caution, because the diagnosis of missed abortion is usually made by multiple ultrasound scans. When a lady comes for a scan, and at the end of fifth week, we can say she has a yolk sac and a gestational sac, and the after a couple of weeks she has the same thing, only the sac diameter is developed. So that means the fetal pole is not come still. So when the fetal pole has not come, then we tell the patient to come after one more week. So then we can confirm it, whether it's a blighted ovum or whether it could be a missed abortion. In ultrasound, cannot demonstrate a clear cut heartbeat. It's always reasonable to repeat the ultrasound in 7 to 10 days to avoid any error. In presence of first trimester bleeding, ultrasound is also indispensable in the early diagnosis of ectopic pregnancy and molar pregnancy. Ectopic pregnancy is a condition in which the pregnancy happens not normally. It is in which the gestational sac is seen outside the uterus. It can be seen in the ovary, or it can be seen in any other part apart from the endometrium of the uterus. So that is an ectopic pregnancy. And in ectopic pregnancy, on the basis of ultrasound, we can easily diagnose whether the lady has a normal pregnancy or an ectopic pregnancy, because once we come to know it is an ectopic, on the basis of ultrasound we can find a gestational sac either in the ovaries. We can easily diagnose it. Third uses of ultrasound is determination of gestational age and assessment of fetal size. Fetal body measurement reflects the gestational age of the fetus in patient which has uncertain menstrual periods. Measurements must be made as early as possible in pregnancy, because we can arrive at the correct dating of a patient. So there can be a lady who has irregular menstrual periods, and she gets a pregnancy strip done and she's pregnant. Now she comes for scanning. She doesn't know how many weeks she's pregnant or how many months she's pregnant. So on the basis of ultrasound, we can tell that what is the exact gestational age of the pregnancy, how many weeks the pregnant lady is. And that will really help us for getting the dating of the scan, because on the basis of this dating, later the estimated date of delivery can be easily find out on the basis of ultrasound. There are certain following measurements which we usually do. One is crown rum length, that is CRL, which is usually done in 7 to 13 weeks, which exactly gives us the accurate estimation of gestational age. Dating with CRL can be within 3 to 4 days of menstrual period. So CRL is one of the most important measurement. And in CRL scan also, we also see at the age of 12 weeks nuchal translucency scan. Nuchal translucency is a measurement which we do at 12 weeks of in a pregnant lady. So on that basis, we can do the nuchal translucency scan. Then there is a second parameter which is called the biparietal diameter. Biparietal diameter is usually measured after 13 weeks between the two sides of the head, upper and the lower pole, pole of the head. It increases about 2.4 centimeter at 13 weeks to about 9.5 centimeter at terms. There are different babies of the same weight can have different head size. Some babies can have a bigger head size, and some can have a bit reduced head size. Dating in the later part of pregnancy is generally considered unreliable. So always the dating scan should be done at the early of the pregnancy, and BPD should be done as early as feasible. I would suggest always 13 weeks onwards we should measure the biparietal diameter. Third is the femur length. Femur length, it reflects the longitudinal growth of the fetus, where femur length means it's a femur bone. As you all know, femur is one of the most important lower limb bone. So we measure the size of the femur in a fetus, and it increases about 1.5 centimeter at 14 weeks, and it reaches up to 7.8 centimeter at term. So it is usefulness is similar to biparietal diameter. It should be measured around somewhere after 13 weeks. From 14 weeks onwards, we should measure the femur length. Then there is abdominal circumference. Abdominal circumference is the single most important measurement to make in the late pregnancy, because on the basis of abdominal circumference, we can also identify the growth of the baby. Third is the weight of the fetus. So there are multiple equations which we use on the basis of biparietal diameter, abdomen circumference, and according to these measurements, ab- biparietal diameter, head circumference, abdomen circumference, and femur length. On the basis of this, the computer softwares and charts, it presents us an approximate weight of the baby. Then the fourth important uses of ultrasound is diagnosis of fetal malformation. In the case of first trimester, there are usually some chromosomal abnormalities where you can see there is absence of fetal nasal bone, increased fetal nuchal translucency. And what is the use of nuchal translucency? On the basis of nuchal translucency, is a fold is a translucent area on the back of the neck which we measure in the fetus, and it has a standard measurement of 2 to 3 mm. And if it is more than 3 mm at around 12 weeks of gestation, then we can signify that the baby has more chances of getting a Down syndrome. So Down syndrome and 21 trisomy. So before 20 weeks, we can even diagnose on the basis of ultrasound hydrocephalus, anencephaly, myelomeningocele, achondroplasia, spina bifida, gastrocystis, duodenal atresia, fetal hydrops, cleft lip, cleft palate, and fetal heart abnormalities. Ultrasound also assists in other diagnostic procedures, such as there is a prenatal diagnosis which we do. It's called amniocentesis, chronic villus sampling, and fetal therapy. So, when we measure a baby at 12 weeks of pregnancy, and if we measure the nuchal translucency, if the nuchal fold size is more than 3 mm, then the baby, according to ultrasound, has the chances of getting a Down syndrome. So, how to confirm that Down syndrome? There are certain prenatal tests which we can do. It's called amniocentesis, it's called chronic villus sampling. These tests also help us to identify any chromosomal abnormalities in the baby. Fifth, there is a placenta localization. So, placenta is also one of the most important part in a gestational pregnancy. So, placenta usually can be anterior or it can be posterior. On the basis of ultrasound, we can diagnose the placenta as anterior or posterior. So, on the basis of ultrasound, we can diagnose or give an exclusion of placenta previa. What is placenta previa? Placenta previa is a condition where the placenta is at the posterior part and placenta tries to cover the internal os. Internal os is a inner part of opening within the female body. So when placenta can cover the internal os, so because the placenta covers, we can say it as a placenta previa. So there are different types of placenta previa. That is according to which we say grade one, grade two, grade two, grade three, or we even say marginal, partial, complete placenta previa. One of the second other placental abnormalities which we can see in a diabetes or fetal hydrops or even in intrauterine growth retardation. Sixth is multiple pregnancy. You can see there are number of fetuses, there is chronicity, the fetal presentation, multiple babies, twin gestation. We can have a helpful in measurement on the basis of ultrasound. The seventh most important useful is polyhydramnios and oligohydramnios. Within the gestational sac, there is a fluid. that is called amniotic fluid. Now, what is the amniotic fluid? Is one of the most important fluid which should be there in gestational sac. On the basis of ultrasound, we can measure the amniotic fluid in the four quadrants, and usually the normal level is 8. So if it is 8 to 15 is the normal level. If it is more than 15, then we say it as a polyhydramnios. If it is more less than 8, then we say it as oligohydramnios. So what in both of these situations, ultrasound examination is done, which can exclude intrauterine retardation. It can also exclude if there is any congenital malformation. Then the eighth, what are the other uses of ultrasound? It's a confirmation. If we can confirm whether the baby is viable or no. We can confirmation of intrauterine death of a baby. We can confirm of a fetal presentation. There are certain at the second and third trimester. Usually, once you reach 8 months of pregnancy, one of the most important question every patient wants to know is, where is the baby head? Is it up or is it down? So, on the basis of ultrasound, we can tell exactly whether the baby's head is on the upper side or it is at the lower side. If it is at the lower side, we say it as a cephalic presentation, which is a normal presentation. And if the baby head is above, it is called a breech presentation. According to the articles, the cephalic presentation, when the baby's head is at the downwards, at cephalic presentation will have a chances of a normal pregnancy, whereas the ladies who have a breech presentation, it's only 25 to 30% they can have a normal pregnancy, whereas 70% there are chances that they might lead into cesarean section. So next is evaluation of fetal and breathing. We can see how the baby is moving, how the tone of the baby is. We can see the measure the heart rate. There is one profile which we say that is called biophysical profile. It is a biophysical profile which we measure with the help of ultrasound. Along with ultrasound, we also do a stress test. So on that basis, we can find it's a biophysical profile. We take into consideration breathing of the baby, tone of the muscle, fetal movements, amniotic fluid. Normally, the score is 8 by 8. If it is more than 6 by 8, also it is considered to be normal. Then there is a diagnostic of uterine and pelvic abnormalities during pregnancy. So during pregnancy, we can see whether there is any fibroid, which is also called utrileomyoma. Also, we can diagnose if you have any ovarian cyst, because if a lady has a fibroid and she is pregnant, then because of that fibroid, it might operation effect on the baby. So that we can exactly measure the size of the fibroid on basis of ultrasound scan, and we can tell whether that fibroid is causing any compression on the baby, and that is one of the most important useful. Then also we can confirm about the cyst, whether there is any cyst in the ovary. This is one of the most important uses. Then we do one more scans that is called transvaginal scan. We use a vaginal probe. We insert it into the vagina. That is usually done at the early pregnancy. So it gives in the early pregnancy just to see the sac. If we do on transabdominal and if you're not able to see the sac, then we tell the patient to go past the urine and come back, and then we do it in the vaginal scan. On vaginal scan, we can find out whether the lady is pregnant or no. So as early as 6 weeks of gestation, we can do, but vaginal scan is has some limitations. Vaginal scan can't be done in ladies who have ectopic pregnancy, who are showing the clinical features of ectopic pregnancy. So vaginal scan can't be done for them. The transabdominal scan has to be done, and then also we can see a number of fetal abnormalities. Then there is a Doppler ultrasound scan. Why is a Doppler done? Doppler is done to detection of fetal heart pulsation, pulsation in various fetal blood vessels. On the Doppler, we measure the flow velocity of the blood vessels. There is diminished flow in diastolic phase of a pulse cycle because it is associated with the compromise of the fetus. The blood vessels which we mainly see are middle cerebellar artery, umbilical artery, right and left uterine artery, and also inferior vena cava. So these vessels, we see the velocity of the vessel, we see the resistive index of the vessel, we see S by D ratio of the vessel, because these are the measurements which will help us to rule out intrauterine growth retardation, to rule out the to rule out the causes, whether the baby is growing in a normal level or whether there is reduced growth of the baby. Then there is a 3D and 4D scan. 3D and 4D are the latest imaging modalities which have come in ultrasound, which was introduced around 6 to 7 years back. And in this 3D scan, we take a series of image, thin slices, and the computer process these images and makes it a three-dimensional image. So a good three-dimensional image is often very impressive because the patient, if the lady and the lady's husband can see the baby in a 3D image, so 3D quality will always be very good. And in cases of malformation, there are smaller defects like spina bifida. If there is any defect in the growth of the baby, like cleft lip, cleft palate, there is facial dysmorphing, if there is clubbing of the foot, if there are ears which are low set ears, that we can see on 3D scan. The ability is always depends on the experience, and also for 3D scan, there should be a good amount of amniotic fluid in the fetus, its position, and the best gestational age to do 3D 4D is somewhere around 18 weeks to 24 weeks, where we can see baby in a 3D sequence. 4D is where we can see exactly how the baby face looks and the movement of the baby. There are a number of ultrasound scans which we do during pregnancy. We being a radiologist doctors, we follow a schedule. Even the gynecologist also follow the same schedule. It's generally 5 to 7 weeks we do ultrasound scan to confirm the pregnancy, 11 to 14 weeks to measure the nuchal translucency, to see the nasal bone, to see if there is any fetal heart abnormalities, and 18 to 20 weeks we do an anomaly scan where we see the complete face of the complete body of the baby fetus, where we see from the head till the toe, right? We see how the baby's eyes are developed, how the nose is, whether the baby lips are properly developed, whether the baby jaws are properly developed, how is the heart of the baby, whether heart is pumping the sufficient amount of blood, whether the lungs are functioning properly, how about the kidneys of the babies, the stomach of the babies, how is the intestine of the babies, whether the baby's hands are properly grown, what about the legs, whether the legs are properly grown, how is it, whether the bones are properly grown. This all we can see on anomaly scan, which is usually done to 18 to 21 weeks. So that is one of the most important uses of ultrasound. Then after anomaly scan, every month we can do a growth scan, and then at 8 months of pregnancy or 32 weeks, we can also see the growth of the baby. Plus, we can also see the placenta position. We can see placenta is it on the anterior or posterior, or else, as I explained you before, whether it is on the fetal head is upwards or it is downwards. That we can come to know exactly on 32 weeks. Now there are certain images which I want to show you. This is an image where we can see a yolk sac. This is the gestational sac of the pregnant lady. Here you can see these are the twin gestation. You can see one gestational sac, you can see one more. So this is a twin gestation. Here there is a early pregnancy. You can see the yolk sac, gestational sac. Different. We measure the gestational sac diameter. This is called the fetal pole. Fetal pole is the, as I told you before, it is the first step of the pregnancy. Here there is a twin gestation. You can see There is baby one, which is to the maternal right. There is one baby two, which is at the maternal two. And here you can see there is different placenta, one placenta posterior, one in the anterior. So this is diamniotic dichorionic pregnancy. Then this is done at 11 to 14 weeks. You can see this is a normal thickness of the baby at the back of the neck, which I told you, which should be measured. See here the thickness is so much. So that signifies this baby has a chances of Down syndrome. So in this such case, we can do other investigation and confirm it. Here is the head of the baby, here the body. Then here we can see this is called the anomaly scan. You can see the upper lip, lower lip, the chin. This is the head of the baby. This is false positive. That means this baby doesn't have a cleft lip, but it is showing a picture because we took it at a sagittal image. Now this is a classical case of a cleft lip where you can see there is a different amount of space. This is this is the classical 3D 4D image where you can see the cleft lip of the baby. Then this is one where we can see the growth scan. This is called the head of the baby, where this is the biparietal diameter. This is the abdomen circumference we are measuring. And here we can see these are the ovaries. This is the endometrium. And here you can see this is the head of the measurement. This is the abdomen measurement. This is the femur bone which we are measuring here. This is the Doppler. This is called the umbilical arteries. This is the complete baby. Here we can see the chart. Here we can see the peak. This is what we measure RI and PI and S by D ratio. There is different arteries. This is umbilical artery. Then there is a uterine artery, right uterine artery, left uterine artery. Then this is the heart. You can see left atrium, right ventricle, left ventricle. This you can see properly heart. This is usually done at 18 to 21 weeks. And here you can see the 4D images. You can see this is the twin gestation of the baby. This is one baby, this is one, and there is no sac. It is a monoamniotic pregnancy. Here is again the 3D 4D uses. Here you can see we are measuring the atria of the lateral ventricle. On this we can diagnose whether the baby has a hydrocephalus or no. This is the uses of pregnancy, the different types of scans in pregnancy, and the schedule of pregnancy. Thank you to all. And if there are any questions and answers, I'm most welcome. I'll be the most grateful to answer your all questions and answers. Thank you for that. Yeah, yes. I got a question from Mr. Kumar about detecting eye abnormalities in fetus. Yes, we can detect eye abnormalities in fetus as if the scanning is done uh, as early as 14 to 18 weeks, where we can diagnose anophthalmia, microophthalmia, congenital cataract, which is a part of multiple pterygium syndrome. So definitely eye abnormalities can be detected in a baby in a congenital condition, especially the congenital cataract and ophthalmia and microophthalmia. Thank you. Okay, so no more questions. Thank you. Good night.